I want to wish everybody a very happy Nurses Week. Yay! And we here at NNPBC are very, very excited and very happy to host today's webinar. It is the Year of the Nurse and Midwife, Unmasking the History of Indigenous Health. And we have a fabulous panel that I think you're going to find this webinar exceedingly interesting and hopefully a bit thought-provoking as well. And please allow me to turn over the ceremonies to Lisa, who will go ahead to introduce herself and take us away.
Okay, well, welcome everybody. Before I introduce myself, I'd just like to take a moment to do acknowledgement of the land that we each stand on and work on and live on. I am here in Tecumloops, Tishwetmac region, and I just want to acknowledge that as the original owners of dwellers of Canada. I just want to start that way, and I just would also like to just say a quick opening prayer to acknowledge that same, to acknowledge where everybody is and all the work that they are doing. So Mami of Dawi Mau Kanaskumten Kutak Kisagawa Kwa Pamatsawin. Just wanted to begin by acknowledging our sacred creator and give thanks for the breath of life and the wonder of this day and all the blessings contained within it. I want to thank NNPBC for creating this space for us, for the nurses to take time and the healthcare providers to take time and join us. I want to acknowledge the grandmothers and the grandfathers who are the keepers of our knowledge, of our medicines and our healing ways. I want to express my deepest gratitude to the spirit and appreciation to everybody that has made time to join us today. I want to express my deep gratitude for Mother Earth, for teaching us, for being our original teacher and teaching us how to live in harmony. And I'd ask that, I ask for guidance today in that supporting us and supporting the nurses and the healthcare providers who are imparting their own knowledge and understanding of Indigenous health. And with that, I want to acknowledge all the children and the elders of our land as well, carry them and protect them as we navigate COVID experience. So with that, hi, thank you very much. And I think to start off also in a good way, we've asked Francine if she would start us off in song, recognizing our own Indigenous knowledge systems and that. So Colleen, Francine.
Okay. All right. Thanks, Lisa. Thank you for asking me to be a part of this very important webinar. And I want to acknowledge that I'm on the traditional territory of Snuneymuxw. I'm here in Nanaimo. And the song that I would like to share with you all is, it's called our Cedar Bough Entrance Dance Song. And I come from, this is from my Nukhalk side, my Balakula side. And the song was given to the late Dr. Margaret Saiwalis, she was one of our matriarchs, and was given to us by who Hupecheset, very well respected elder Ron Hamilton. So he's given us the permission to use this, and we use this song. We start off with this song when we have our potlatch, and we hold the cedar bough, and we hold the cedar bough, and then we dance and sway it back and forth, and it's clearing any energies, any negative energies, and it's just creating a really good space for when we go out and start our ceremonies, our songs and dances. Way Allah, way Allah, way Allah, way Allah, way Allah, way Allah,
Mhm. Beautiful. Wow, beautiful. You know, to think about where we've come in nursing and to start in our own ways of knowing, in our own languages, in our own songs, um, is very powerful. So thank you all for taking the time to join us um, in this webinar. And so I'd also like to call on our dean from Thompson River University, Ronnie, to start us off with some welcoming remarks on Year of the Nurse and National Nursing Week.
Thank you, Lisa. Good afternoon, everyone. It is my absolute privilege and pleasure on behalf of Thompson Rivers University and the School of Nursing here to welcome you all to the webinar, Unmasking the History of Indigenous Health. It's such a wonderful beginning to mark National Nurses Nursing Week 2020. And as you know, the theme of this year is Nurses, a Voice to Lead, Nursing the World to Health. And at this time of the global health crisis, I think the theme is very fitting. Nurses are playing an important role all over the world to educate, support, and nurse individuals and families and communities. And it's just absolutely phenomenal. I want to do a few acknowledgements, and we are particularly grateful to NNPBC for their partnership and support in getting this webinar launched so we could all come together for this very important dialogue. And I'm so pleased to see we have 74 attendees right now registered. That's absolutely amazing. I also want to thank our panelists for taking the time to share their wisdom amidst so many competing demands. This is a busy time, and we are honored and grateful that you've been able to make some time and space for this, and I'm excited and looking forward to hearing from you. And then lastly, my gratitude to all of you who have joined, all of the participants. I'm confident that this webinar will spark conversations that will continue to strengthen our ability as nurses to deepen our own knowledge, our own commitment, and truly nurse the world to health. So with that, I'm going to turn it back over to Lisa to introduce our panelists and get us started. Welcome again, everybody, and happy Nursing Week to you.
Thank you very much, Ronnie. That was very nice. So just to give a little bit of context, and I think Ronnie already alluded to that, was that this year we wanted to particularly highlight the history of Indigenous health nurses. And so this specifically came in response to the Nursing Now Nightingale Challenge, which was presented by the World Health Organization, that called for every healthcare employer to contribute to transforming nursing practice. And when I read this, it really resonated with me, because I think there's this whole story about Indigenous nursing prior to Nightingale. And not to take away from any celebrations of Nightingale, because I think the work that she started and has continued to live on over these years is phenomenal. But something that had happened with colonization is the erasure of Indigenous knowledge and the role of the healers and the helpers and the health professions working within those nations. And so it was clearly documented in her nursing notes that there were these original people who were succeeding and had very strong health systems. So just trying to dismantle some of that history so we can root some of our own Indigenous nursing work within that framework, because we do know that a lot of these Indigenous health systems have been underground and been working, and even now in COVID that we see is people have gone back to their traditional medicines. They've gone back to lighting their home fires. And so, you know, the communities are really leading the way in that way forward. And so I had the great part of why one of the reasons that I thought it was so important to invite Dr. Danielle Ben-Smith with us today is because she had the privilege of getting a glimpse of that globally on the role of healers, and, you know, listening to her and her experience through that was been phenomenal. So without taking up too much more time, you know, we just wanted to really create a comfortable place here to really just allow people to speak from their own perspective. So with that, Danielle, do you want to introduce yourself a little bit, and then you can go right into your talk?
Sure, that sounds great. Thank you so much, Lisa. It's so nice to see you again. Lisa and I worked together well over a decade ago now, when we were both at the University of Alberta. And yeah, it was so lovely to get the call to join you guys today. And I feel very honored to be here. And yes, happy Nurses Week. Where would we be without you guys? Don't even want to think about it. I'll just begin by acknowledging that I'm very grateful to be calling in from my home on the territories of the Lekwungen speaking peoples of the Songhees and Esquimalt nations. And I'm Etchodene from Fort Nelson First Nation. I'm French Canadian and Métis from the Red River Valley. And I'm a rural family physician by training and early career. And I've gradually moved farther and farther upstream, and now find myself working as the Deputy Provincial Health Officer for Indigenous Health, and feel really lucky that I get to do that work. But what brought me into healthcare, it's, yeah, just, I guess 20 years ago now. It's hard to imagine that that much time has passed, but was really just the sincere desire to help, and also to find myself and understand my indigeneity better. I have a similar story, a story that I'm sure is similar to many, in that I didn't have the privilege of growing up directly in either of my communities. I grew up in an urban setting, and so didn't have necessarily all those connections to culture and customs and language that that of course so many of us would have liked to have had. In any case, when I got into healthcare, I thought that that would be one avenue to reconnect with myself, but also with other communities, and work in the area of Indigenous health. And I worked really diligently. And as you all know from working in a Western healthcare system, it's not always the right fit to bring health and wellness and healing into our communities, or necessarily the best fit for Indigenous clients and patients. And so after the end of my training, I was so burnt out that I was ready to leave medicine altogether and just do something completely different, because I was so drained, and all of that hard work had fitted me with a toolbox that was totally inadequate and incapable of supporting people on their Indigenous people on their wellness journeys. I'm not sure it's such a great fit for mainstream either, but specifically Indigenous. So I prayed to the Creator just for anything else. I just said I couldn't do this anymore, and I would do anything that was put before me. And after a particularly challenging locum, I was just absolutely done. I was crying myself to sleep. And when I woke up the next morning, after I'd made that very bossy prayer, there was an email in my inbox from a television production company looking for a female Indigenous physician to travel around the world and meet healers, which was so remarkable. And in my my youthful hubris, I'm not even sure, my arrogance, I said, "Oh, Creator, you didn't hear me. Like, I don't want to do medicine," because it was framed as traditional medicine, and I was like, "No, I can't do that anymore." But yeah, thankfully I had another sleep and applied, and was given this really incredible opportunity to travel around the world. So I got to, we traveled to Fort Nelson. We spent some time in the Red River Valley, both places where I'm from. And then we traveled around the world and set foot on every continent except for Antarctica. And as you can imagine, it was incredible. It was transformative. It was healing. And I really came to understand what those universal threads of Indigenous healing are all about. And I learned that health and wellness are about being balanced in mind, body, and spirit. And it's about gratitude and respect and ceremony. And that everything is ceremony. So not even just sort of the elaborate and very sacred rituals that we undertake, but also each breath that we take, each meal that we prepare, every glass of water that we drink, it's all ceremony. And so that was so wonderfully transformative. And then I came back into our regular Western healthcare system and grappled with how do I get all of these different pieces to fit. It was really challenging. It continues to be challenging, and that's part of the reason that I've moved farther and farther upstream. But what I'm hoping I'll be able to do, because unfortunately due to COVID, I wasn't able to send Lisa any slides beforehand, but I'm hoping that I'll be able to read you just something very brief, if I can share my screen. Oh, I cannot start screen share while the other participant is sharing. Lisa,
Okay.
do you know if there's a way that I can?
Yes, I will stop my share right now.
Okay.
And
Okay.
then you
And
should
then
be
I'll
able
try
to-
again. Thank you. Thanks everybody for your patience with me. There. Are you seeing my screen now, Christy Belcourt?
No.
No, that's not happening. Let me try again. Share. Oh, it's letting me pick from here. Okay. How it's really smart, this Zoom. Okay, there we go. Are you able to see that now, Christy Belcourt? So I found this image from Christy Belcourt a few years back, and it's just this perfect summary of everything that I learned on that journey, which is, and I'm sharing my screen. Are you guys seeing yourselves, or? It's very confusing, but I'll just quickly read. So the plants are teachers. They are connected to each other and all other spiritual beings through the sacredness of life. When I remember who I am, a human being connected to all of life, I remember also that I'm loved by the spirit world and our ancestors. And when I remember this, I remember to respect even the smallest of things. My traditional, one of my traditional names is Azenezu, which means crying all the time. So even just reading through this now, I think of, you know, how it resonates very deeply for me, and was really everything that I heard from these amazing, generous healers from so many different places. And then I just want to share one other image. I hope that it will come up, and then I will pass it on to the other amazing panelists. I'm wondering if you can see now an image of two circles. Does that come up for you?
Not yet.
It's
No.
still Christy Belcourt. Okay, just bear with me one moment while I try manage controls. It's so beautiful. I really want you guys to see this also. There, let's see if this will work. There, are you seeing an image with two circles?
Oh, yeah.
Yeah, so this beautiful image was created by Lisa Boyven, who's a DENA bioethicist working at the University of Toronto. And it was published in the Canadian Medical Association Journal last fall. And it's called Sharing Bioethics. And so I'm so grateful for this image, because for me and those of us working in the healthcare system, I think it's such a beautiful visualization, representation of what this is all about. Like when we're thinking about the impacts of Canadian colonial practices and policies on Indigenous people's health, which often gets shortened to just Indigenous people's health, and it kind of ends up equating, you know, all of the negative health outcomes with our indigeneity, when in fact all those negative health outcomes are really related to those Canadian colonial practices and policies. But ultimately what this image reminds me of is these two worldviews. And that's really what I learned from the healers when I traveled around the world, was that we have distinct Indigenous worldviews, as Lisa was mentioning. We have, you know, we had and we still have our own health systems, education systems, justice systems, and all of those systems prior to contact were sophisticated and effective. And they were all disrupted also by contact and colonization, but they're still there. Our elders hold that for us. You know, we've got knowledge keepers who hold that, and I believe we carry that in our DNA as well. And so these two circles that Lisa has put out so beautifully depict for me that intersection and just remind me that my work and my calling is really about trying to figure out and find ways to activate that intersection in a good way, and to find ways to make that connection culturally safe. And I love that she has, I imagine, deliberately made the Western healthcare system circle smaller and, you know, privileged those Indigenous concepts of health and healing. I think we need to do that in order to strike a balance again. That dominant mainstream way of approaching things is so, in the words of Willie Ermine, it's that unseen or colossal unseen dimension. So I love that she reminds us in this image that these interactions, these encounters, whether it be individuals or communities or systems, ultimately are about these two worldviews coming together, and that if we use Elder Albert Marshall's and Merdina Marshall's concept of two-eyed seeing, that we actually can come together and create a new way of seeing that benefits all of us in a really beautiful and powerful way. So as I say, there's some really incredible speakers on the panel, so I don't want to take up any more time, but I am so grateful to Lisa for letting me sit in on the webinar today and share a bit of my experience, and also to be able to share these two images from these incredible Métis and Dene artists who, again, for me, create these visualizations that just resonate so deeply and help me in my work. So Masi Cho, and I look forward to continuing the conversation today. Thank you so much.
God, I really appreciated that. And I love that I can see people's faces. I was having anxiety not being able to see anybody's faces. With that, Danielle, will you be around for questions after? Can I just push through?
I'm gonna stay for the whole thing. So I'm here. Although I might just jump out and get a glass of water, but I'll be right back.
You betcha. Thank you. And so with that, you know, I think it gave us a beautiful context now to situate Lucy's conversation. She's done so much work in terms of her master's program and trying to articulate what that exactly looks like in nursing practice. So Lucy, without any more interruptions from me, I will share the slides.
Okay. Hi, everyone. My name is Lucy Barney. I'm from the Lillooet Nation, Stalliam territory. My mom is in Quatqua, and my dad is Fitkit, so both Stalliam. I am an RN, MSN. I'm happy to be living and playing on the Tsawwassen First Nation. Grateful to have the opportunity to be here with you today. I too cried a lot in my nursing career because it was hard. You know, I had mentors. There was no one who went past grade 10 in my family of 13. So I was the 12th of 13. So I was, I guess, the chosen one to go on to get my education outside of Lillooet. So during nursing school, I would read articles, you know, do the homework we were told to do, but it was very foreign to me. And then all of a sudden it came to me that what was missing was the spirituality of the person, the wholeness of the person. So when I was at Langara doing my nursing, I was experiencing anxiety and depression because I was working, I was going to school, I had a young family. and a husband who didn't know how to make toast and coffee. So I went to the psychologist at the Langara School and followed his regime for a few months. Didn't work. Finally went to the First Nation liaison, and she gave me some smudge and she said, go find a quiet place. And it was there that I realized that I was missing my own spirituality as a person. And to be able to get through nursing school. Lisa, I wonder if you could just put it on the first braid theory for me, because I'm not able to do that right now, the first one. Well, I was, when I completed my nursing school, everything I did and how I was able to achieve nursing school was I read every article and I looked for the gaps. Where was the spirituality in all of those articles that we're asked to read? And then I filled in those gaps with everything that I did in nursing school, because it was so important. Lisa, the first slide with the 3 strands.
I just have the 2. Sorry.
Okay.
Sorry.
All right. So
this one?
No, that's fine. No, go back to the other. That's fine. I'll just carry on. So what happened was I was able to graduate nursing school. Then because my mother had diabetes, type 2 diabetes, when I was growing up in Lillooet, I didn't understand what was going on with her. And she didn't understand, the doctors and nurses didn't understand. So she developed complications. And so I made it my responsibility. So when you look at a person, they come with a mind, a body, and a spirit. And when you look at First Nation people, we have a beautiful history of being strong, family-oriented, community-oriented. We had ceremony that kept us strong and healthy. We had our own traditional medicines. Then what happened, residential school, the Indian Act and the 60s scoop and all that stuff came into play, which made us very unhealthy. We didn't know how to cope with all the abuses and the hurts and the harms that were happening to our people. And therefore we developed unhealthy things like alcohol addiction, cigarette smoking, drug addiction. We had low self-esteem because of how we were treated in residential school. Both my parents and older siblings went to residential school. I was one of the lucky ones where I didn't have to go, but still I experienced, the outcome of. So with that in mind, we are so overrepresented in so many physical diseases such as HIV, diabetes, heart disease. It's because of everything that is affecting us under the mind, and that is the oppression that we experience in residential school, the Indian Act, the racism that still occurs today, the low education levels because of the racism, not being able to get that education that we want, and the low self-esteem. So when we develop those diseases and we're finally diagnosed, we can't deal with them because we're still dealing with the things that are under the mind, like the oppression, the depression, the addictions. So what we need to do is we need to bring back who we are as a people, and that's our ceremony, our way of being family-oriented, that kept us strong, our own prayers, our way of being. And so when you create a program or you're working in a program, it's really important to look at the mind, the body, and the spirit, not just the physical aspects of a person. It's all about cultural safety and humility and trauma-informed care. When you weave the mind, body, and spirit, you are providing that cultural safety, the humility of learning, and the trauma-informed care. I want to thank all my mentors, from my parents and family to the nurses and to the elders who supported me in being able to learn this. And when you create your programs, you need to braid them strong, as this lady is doing on the right side of the picture. She is braiding really strong and ensuring that everyone receives holistic care. Thank you all, and happy Nurses Week.
Lucy, what can I say? You always get right to the heart of the matter, and I think when we come into nursing, you have been very generous with your heart, and there's something very beautiful about the vulnerabilities we all hold. So thank you for sharing that with us today. Next, I would like to call on Dion.
Yes, thank you, Lisa, and thank you, Lucy and Danielle, for your beautiful words and your real personal reflection. Lucy, I felt that in my heart. It's been a busy day. I sit on a lot of emergency operating center work, and it's very cerebral, very crisis oriented. So to hear from both of you has really humbled me. It's brought me back to my heart, and really proud to be here today, honoring Nurses Week, and especially Indigenous nurses and Indigenous health. So I'll begin by introducing myself. My English name that most people that I work with know me as Dion Tavares. Known in my community and my family as Amhalach. I carry a traditional name from the Lilwat Nation, where my mom comes from, and I carry my grandfather's name on my mom's side. My dad comes from the community of Nakwatwa, not too far from Lilwat, and so I consider myself a true Statlium person. And very proud of it. And I think the three panelists today, the nursing panelists anyway, all have some roots within the Statlium territory. So hands up to Statlium folks today and Statlium nurses. So I want to acknowledge that I am here in the unceded homelands of the Musqueam, Squamish, and Tsleil-Waututh Nations. I live in the west end of Vancouver. And I'm going to really date myself here. I've been a registered nurse for 27 years. I am alumni of, back then we used to call it Caribou College before it actually became Thompson Rivers University. And yeah, so very, very proud to be alumni of TRU. I've worked in acute psychiatry and community mental health for nearly 16 years. And for the past 10 years, I've worked with Vancouver Coastal Health for our Aboriginal health team. And most recently, I'm working as Director of Aboriginal Mental Wellness, Substance Use, and Special Projects. And it's been quite a journey for me too in my nursing career. I never added in my little cheat sheet and speaker's notes to talk about the vulnerabilities that we have as Indigenous healthcare providers, but I can absolutely relate to the challenges the previous speakers have talked about. And I will actually talk a little bit about it in terms of how I bring some of that passion to make sure that we're well resourced and looked after as Indigenous people working within the system. And but I can definitely relate to those stories of being an intergenerational survivor of residential schools, and knowing the impact and the anxiety, the depression, the self-esteem stuff that came up about being Indigenous and training in a very patriarchal system at the time. So I want to start off by acknowledging the healers, acknowledging our knowledge keepers, and especially our women. A day after I got to spend afternoon with my mom yesterday for Mother's Day, and the medicine I got from that. And so I want to raise my hands and put my hands up to our other panelists, our Indigenous nurses, and our healers, our elders. And I was really reflecting on the role of nursing, and especially Indigenous nurses. And we really do have a unique role, you know, especially where we are in society today. as Indigenous people, I think, you know, we could get overwhelmed and have that anxiety, or we can step into our power. We can step into who we are and assert and bring forth who we are to have real system change. And I think as nurses, you know, this is something I really took to heart when I was in nursing school many, many years ago, when it was Caribou College at the time, and how it was really emphasized, the conceptual development around nursing was really about the art and science of nursing, you know, and it was really the science and the medical piece that drew me into nursing. But once I got into nursing, you know, it was that intuitive piece. It was that place where we could bring in other alternative ways of being, alternative ways of knowing. And going to school back in Caribou College and working at Royal Inland Hospital, I met some amazing seasoned nurses that were really able to combine those two fields of bringing the art and bringing the science together. And those were our true healers, those seasoned nurses. And we do that in a way as nurses, especially these days, in how we're moving into positions such as positions that I'm in, the positions that Lucy is in, and Lisa and whatnot, and how we bring that that art into our leadership, whether that be in clinical practice, research, administration. We're having really big effects everywhere. And I really like how Lucy had created, developed, and shared, you know, about the braid theory, because I think as nurses, you know, when we talk about Florence Nightingale, we talk about our traditional health systems where we had our own midwives, and my grandma was delivered the babies in our community back in the day up in Nequatqua. We didn't have road access very well back then. And so, you know, as nurses, we really combine our past, our traditional knowledge, the present, and we're actually very quite forward thinking and changing systems today. And so what does that look like when we're influencing systems like that? Nurses are integrating social and health policy. Lucy had talked about how we are very history and trauma informed, and we're decolonizing practices. You know, we're seeing our elders in residence programs. We're seeing our traditional knowledge keepers. We're seeing elders right in acute care these days, affecting direct patient care. So I think that's really, really exciting. And so in my current work, you know, I bring my way, you know, into developing a regional strategy for Indigenous mental wellness and substance use with our Vancouver Coastal Health regional partners. And that is because of the work that our executive director, Leslie Bonchor, has done in opening those doors for Indigenous people to actually be really effective and impactful in the workplace. And by doing that, it's to be able to do that, we have to really to bring forward who we are and assert that. And so right now I oversee, you know, not only the strategic development, but an adult counseling team, an Indigenous trauma therapy team, an outreach team, and as well as a virtual team that we're able to support our practitioners in rural and remote First Nation communities. That's a really new program that we're doing in partnership with First Nations Health Authority. So in doing all of that work, what I've really come to know, so I'm alluding back to what I talked about a little bit earlier, is that something that we don't always talk about is the impact of our work. And this really came through to me when I recently took trauma-informed practice training. And I was doing it to audit it because I wanted to bring an Indigenous lens into it. But I actually walked away, you know, with a gift. And that gift was that aha moment where in that training, they talked about, we don't often talk about the big pink elephant in the room. And that is our own cultural safety and our own psychological safety, working in environments that have historically been quite oppressive and racist. And so we don't talk about that cultural safety, that psychological safety. And so that's why in my work, I'm kind of championing two main pieces. One is Indigenous cultural safety policy. And the other one is we're in the very beginning stages of creating a workplace wellness strategy and looking at creating standards for psychological safety in the workplace for Aboriginal health, which I think is going to be really critical and important as we move forward, because we can obviously hear some of the distress that we've each experienced as Indigenous people, training and learning and often wanting to leave, you know, our respective professions. Something I have considered before too. And so what is that impact then? It's really where we see, and what I've observed in my colleagues and in for myself, a moral discord, you know, and when we don't address that, it really leads to a place of moral distress, which, you know, over time can really cause mental injury. So that's why this is a real passion for me. And that happens when our values, you know, our traditional knowledge, our ways of being are not reflected in our work. And when we aren't included in decision-making at all levels of healthcare and planning. And when our definitions of health and wellness, like the braid theory, you know, are not valued and included. And again, like I said before, like when we experience racism and discrimination in the workplace. You know, so to mitigate that, part of the policy that we have has 3 pieces. And the first piece is very basic but really powerful. It's around honoring, acknowledging, and respecting unceded homelands of where we do our work. I've trained over 3,000 Vancouver Coastal Health staff from executive teams to frontline staff. And we're seeing this happen now in the workplace, and people actually have land acknowledgements, and they're really situating themselves, you know, and they have it on the agenda. We're even seeing some community health centers in Vancouver Coastal Health actually paint land acknowledgements on their wall, designing their facilities that are really welcoming to our people when they actually enter those facilities. The second piece is the inclusion of Indigenous knowledge and expertise at all levels of healthcare planning. And this is really important. And this is something that our executive director has been able to do to expand our team to ensure that Indigenous voices and knowledge are included from patient care delivery, program planning, research, human resources around recruitment and retention of staff. Right now we have patient navigators supporting Indigenous patients, elders and residents. We have a new Indigenous professional practice lead who's been hired on this past year to support us with this policy development. And then the third piece is the facilitating access to traditional medicine and practices. And so I'd mentioned before around the smudging and the elders and prayers and whatnot. So we're really happy to promote those 3 pieces to help mitigate some of those impacts, not just on patients, but us as well as healthcare providers. And the last piece is what we're working on is the workplace wellness plan, and to really take a look at bringing in decolonized practices to support our what we hope to create is a community of practice, so we can actually identify our Indigenous health staff within the system if they want to be identified, and really explore ways that we can support our teams. You know, we can have those circles where we can talk about the impact, where we felt not included, not heard, where our knowledge wasn't incorporated, and really bringing in those national standards for psychological safety in the workplace. And so I'm really looking forward to moving forward with that in this new year, and being able to support us as nurses, Indigenous nurses and physicians in the workplace. So that's what I have for you today. I hope there's some ideas and concepts that resonate with you. I know as nurses, we're all well situated, you know, to have really positive impact, and physicians as well. When our work is valued, our way of knowing is valued and included. So all my relations, everyone, and good to be with you today.
Wow, Dion, that was amazing. It's so weird not to be able to see you guys. I'm sorry. I'm just so disconnected here. But I just really listening. That was excellent. And I think you did definitely give us lots to think about. And so I want to now turn it over to Francine, who's in the crux of practice as well in one of our northern and rural remote communities. Francine.
Yes. Thank you, Lisa. Just going to move my chair forward.
I was going to say, could you turn up your volume maybe just a little bit?
Oh, sure. If I can get to...
Oh, I just need to see you guys.
Where is there a spot on, like I'm on the...
No, on your computer?
Oh, okay. I have to minimize. How do I? Sorry. I'm trying to minimize my screen here.
And if you can't, maybe other people can hear you.
Okay. Oh, somebody said they can hear me. Yeah.
Oh, there you go. That's way better. Yeah.
Oh,
Perfect.
that's better?
Yeah.
Okay.
Whatever you did.
Okay. Well, thank you once again for having me a part of this. And I'm just feeling very inspired, and I'm feeling, you know, very, very grounded from hearing from Danielle, Lucy, and Dion. Thank you for your words. It's pretty much going to fall like it's, you know, we're talking about, you know, colonization, the impact of colonization, the strength and the beauty and the resilience of our people. And then here we are smack in the middle of a pandemic. Well, first I'd like to properly introduce myself. Insti ilistais, insti sudach, insti sonhuna, insti kamayatsa, uklama sasen. Those are my Nukhalk names, my Catholic name, and a Nuchanoth name that was given to me. And I'm really honored to be alongside of my colleagues, my family, my Statlium family. I also want to just reflect on Sauce. My name Saucen means hummingbird. And a few minutes ago, there was a hummingbird that flew up to my hummingbird feeder that I just put up the other day. So I'm feeling very, very grateful and very thankful. We're in times right now that I've been finding that it's all about the little things. It's all about the small things that I just have. I'm feeling like I have so much gratitude, even more gratitude for life and for everything. So unmasking the history of Indigenous health, when I first read that, I was like, wow, that's a big sentence. So I looked up unmask. What does unmasking mean? And one meaning was expose the true character of our hidden truth and bringing to light. And I feel right now we're just at such an opportune time for our people. And when I say our people, I'm referring to all Indigenous people. I'm used to saying our people, but I'm referring to all Indigenous people across the world. So when I think about the history of our Indigenous health, I think about pre-contact. And I think about, you know, how was that? What did it look like? How did our people live? And they lived off of the land. And everyone had a specific role. Everyone had a purpose. Everyone mattered. There was, when I think about health, well, what does that look like? What does Indigenous health mean? And it means our languages, our land, our traditional foods, our animals, our songs, our dances, hunting, fishing, berry picking, the harvesting of medicines, ceremony. All of this is our health. And it's, you know, looking at all of this as the overall well-being. When you look at our communities and you look at all of these that are coming back, and they're coming back very strong. A lot of our our traditions around medicines. You know, they are. I see them. I see it coming back really strong. Just thinking about my Auntie Faye, she shared how they're making medicines right now during this time for being in this pandemic, that it's immune boosting traditional medicines. And then of course, you know, we spoke about contact and what that looked like and what it led to, the many disparities of our people when the European foods were introduced to our people, residential schools, and all of, you know, the list goes on, the impacts. We all know the history of what that's done to our people. Then I look where we are now. And one thing that I've been really thinking about, being in this pandemic and seeing what's happening across our country, and I see our people taking a stand. I see them using their voice. I see our hereditary chiefs taking that stand, and that they're in the forefront. And so when I think about that, when I see that, the word that comes to my mind is sovereignty. And sovereignty being our traditional ways of life, that we as First Peoples of this land, we had our traditional government systems that were in place for our people. And I looked on our Nukhalk website, and this is available, that you can go and it is on internet. And it says, our sovereignty is our traditional ways. It is our fishing, hunting, ceremonies, laws, stories, songs, potlatches, and dances. Our sovereignty is a sacred gift handed down to us by Dadao, our creator. It is something that was never given to us by any government or business. Our sovereignty is not the Canadian government's laws. Our sovereignty is not the British Columbian laws. These two governments do not have any right to practice their man-made laws over our laws that were handed down to us from the Creator. Our sovereignty is when we hunt, where we hunt, when we hunt, and where we fish. Our sovereignty is our plant, foods, and medicines. Our sovereignty is our traditional way of life. No other nation is given the permission to define our sovereignty. And it ends with, as long as we keep our sovereignty, we shall survive as a nation for the future of our children, grandchildren, and children yet unborn. Why? So that's what, like, when I, you know, think about the stand that our people are making, and that, you know, they're directing, you know, this is what needs to be done. And they're standing up and taking their rightful place to have, you know, their voice and their say, so that they're protecting their people, they're protecting their communities, they're protecting their community's health. And then another thing that I was reflecting on was, you know, when you hear the term, you know, vulnerable or at risk, and I always struggle with those terms, because I don't feel that our people are vulnerable. Our people are high risk. So then I was thinking, and I wrote down some notes the other night, and I said, I don't think of our people as being vulnerable or being classified as high risk. This is a symptom. The vulnerable and high risk is a symptom of our healthcare systems and a direct result of colonization. Vulnerable, high risk is a symptom of our healthcare systems and a direct result of colonization. And I firmly believe that 100%, because when I think of our people, it's the same as you all have said. I think of the strength, the beauty, and the resilience, and that as each day goes on, we're just getting stronger and stronger and moving forward in a good way. Another note that I made here, our ancestors overcame historical pandemics such as smallpox and the Spanish flu. We continue to face communicable disease at a higher rate, such as tuberculosis. But we will continue to overcome, and we'll continue to move forward. And I want to end with one of the strengths that our people are just getting stronger and stronger is with the cedar weaving. And when you think about the cedar weaving, there's so much work that goes into, that's involved, like the creation of a cedar hat. This was made for my daughter by my sister Wanda. And you think about, the first step is you got to think about where you're going to go and you're going to harvest the cedar. So you're going out onto the land. But it's not only that, you find that perfect cedar tree and you do the work that needs to be done to remove the cedar, and there's ceremony involved with that. And that's just being that connectedness to the land, to nature, to your loved ones that you're out there with and you're learning from. Cedar is, there's so many ceremonies around it. It's very strengthening and strong, and it protects us. And then there was a story about, that my Auntie Faye shared with me about cedar weaving, and that she witnessed her relative that was going through some really challenging times, and she was watching her when she was weaving, and she said it was medicine. It was healing her. She could see that it was healing her. So just the very act of weaving is very healing in itself. So I thank you. I thank you all. I thank you, Lisa. I mean, year 2020 has been declared Year of the Nurse and Midwife, and wow, what a year we've been given. But I'm like, challenge accepted. I'll take it, and I wish you all the best.
Oh, that's wonderful, Francine, and I'm just mindful of the time, and I want to give our Associate Dean time to give thanks on behalf of TRU, but what I really wanted to do is just really, again, just encapsulate the important work that each of you are doing. And in my, and so I've invested my time in really trying to create space for Indigenous nurses to really start articulating what reclaiming our Indigenous health systems. So from my own lens, it's our Nihawa systems, right? Nehiyaw, create systems of knowledge and what that looks like, because I think every nation has their own systems. And so that we just, encouraging people, healthcare providers, to go back and not to go back and stay there, but to go back and bring forth, because we know now, and this is Madeline's teaching, she's been one of my dearest teachers, tradition is more modern now than ever before, right? So we are going back and bringing in those old knowledge systems into a new system. And I just wanted to quickly respond here to the comment of marginalization and equity seeking. I think those are terms that, Western non-Indigenous peoples use, but I don't think it captures, as Francine and Lucy and Dion really articulated, those aren't our words to articulate how we see ourselves as Indigenous nurses. And within this research platform that I'm doing or trying to create, it's been really telling to listen to some of the interviews right now from and these aren't just Indigenous nurses, these are Indigenous, respiratory therapists, pathologists, lab techs, nurses, doctors came together and had some circles. And I was overwhelmed, and I'm still overwhelmed. And to hear that our Indigenous young nurses coming into our system are still facing those same challenges and tribulations that were there 30 years ago. And so that tells me that we need to work harder, and rather than working and pushing back against the system, I think we need to invest our own energies into really articulating what the nations where we work and what that means to them, so that Lucy, you really talked about that your presentation, and Dion, you also brought in the concept of cultural safety, and that to me is fundamental with cultural safety. It's creating safe spaces for Indigenous people to lead. So this is what we all need to support Indigenous nurses, Indigenous healthcare providers, Indigenous helpers, and continue to really advance that work. So I want to really thank you all from the bottom of my heart that you came here and you shared. And you know, I'm very privileged to be here at Thompson River University because they've been long-standing champions in bringing forth cultural safety, indigenization. So with that, I will turn it over to Tracy for last words. Tracy Hoot. Is she with us?
Lisa, it's Ronnie. I wonder if Tracy, I'm not seeing her on the panelist list, so I wonder if the way she logged on as an attendee, she may not be able to speak.
Oh, okay.
So why don't I step in, and on behalf of Tracy and Thompson Rivers University School of Nursing, just extend my heartfelt thanks to the panelists, because I think each one of you has given us so much wonderful thing to think about. You've raised some phenomenal points, and I knew when I said my opening remarks that I think the dialogue will give us lots of food for thought to think about and reflect on, and really think about how it impacts on the work that we do with our students, with our patients, families, and communities, with each other. And so I want to say a big thank you. I just want to echo what everybody else has said. You've touched our hearts, you've touched our souls, and you've kind of got us inspired to think. Been watching the comments. I also want to take this opportunity to thank Lisa, who really kind of took the initiative to pull this panel together. And it's amazing how sometimes ideas come together. And I know we at Thompson Rivers University are fortunate to have colleagues like Lisa who are there championing Indigenous health and Indigenous nursing, but also teaching and guiding and helping us understand how we need to be better, for all students, and particularly our Indigenous students, because that's how we're going to have a very vibrant nursing workforce. So with that, my sincere thanks for the panelists, and also again to the participants. We've been watching the chat box and the comments that are coming, and we're grateful for your participation. And I know that NNPBC has already, the recording of the webinar will be available to people afterwards. And so with that, I'm going to, again, say thank you and turn it back over to Lisa if there's any final words.
I think Kim was going to manage any questions. Kim, do you want to?
No.
Lisa, before Kim goes, can I just say my little piece now that I'm on?
Sorry, Tracy.
No, I don't know how I slipped in. I must have slipped in as a viewer. And then you can tell, and then I'm so thankful that I'm on video. And then when you go on video, you have to fix your hair. So, so I just want to, as Dion reminded us of the importance to recognize the traditional lands of the Indigenous peoples that we are situated on, I would just also like to acknowledge that I live and work on the beautiful traditional lands of Tecumlip's Shkwepnik within the Shkwepnik Ulu, the traditional territory of the Shkwepnik people. I'm very thankful. I was also, when Lisa spoke to me about the opportunity to help organize a webinar to acknowledge the role and contribution of our Indigenous healers as health professionals as part of the original Nursing Nightingale Challenge to get a start off on the 2020 Nursing Week, I couldn't agree fast enough. And knowing Lisa as I do, she got this with a minute's notice, was able to pull this together. And so I do have to acknowledge the presenters for sharing your wisdom and your personal reflections, and it also acknowledging to us the importance of indigenization of the nursing curriculum. And I'm happy to say that this year will be our first year of introducing a core nursing Indigenous course into the School of Nursing curriculum, so that's exciting for us. We're very fortunate at TRU to have the knowledge of our elders coming into our class and sharing their stories with our students, but we are very thankful that we are able to offer this core Indigenous course. So thank you to our presenters.
So I wonder if anybody has any questions that they wanted to ask any of the presenters. I know we originally on the poster it only said an hour, but we had allocated an hour and a half in case anybody had wanted to raise any questions. Can you let me see everybody before we go?
Yes, yes, I certainly can do that. All right.
Oh,
There you go, Lisa. Happy Nurses Week. It's my gift for you. I think as the questions have been coming in, I've noticed that everybody's been very attentive at answering them. So there doesn't seem to be any further questions. I want to thank everybody for participating today. This has been very, very fascinating and interesting, especially for me. I was able to just hide my video and sit back and listen. And so I was quite a few times I was nodding away thinking, who am I nodding to? I don't know. But I was. So this will be as a recording, and I will obtain the slides from you, Lisa, all of them, and we'll put the slides up and the recording up by the end of this week for sure. And that'll be on the NNPBC website. So that's www.nnpbc.com. And you pop into webinars and past webinar tab, and you will find this recording. And if you think of a question, as I am prone to do about 6 hours after the actual event, you can send an email to info@nnpbc.com and just put question about this webinar, and they will direct it to me, and then I will direct it to Lisa to get the appropriate answer, and I will be your link. That way you're not trying to figure out the person's email address or how do I get it out there. Feel free to send me any questions or comments, and I will pass them along, and that's not an issue whatsoever. Again, thank you, everybody.
could I take a minute to address the equity seeking question? Because that to me is a really important one, particularly when we look at the number of seats that are allocated to Indigenous students. And so Ronnie and Tracy, forgive me, I don't want to offend, but I think we need to do some serious looking at that approach, because right now, I know we call them equity seats, but they actually don't do anything to really leverage the playing field for our Indigenous students, because they still have to meet those exact same requirements. Not that I'm saying that they shouldn't have to meet those requirements, but we need to look at the contribution of Indigenous nurses or Indigenous healthcare providers, because it's often not measured in academic standings. And so with that in itself, we cut off nursing to a huge population of potential students that could really contribute greatly to health, to nursing careers, right? So I think we kind of need to really look at what that means and how we're taking that equity seats up, because it's really not having the impact, I think, historically that we've seen. We were hoping that it would when we first introduced it.
May I comment, Lisa?
Absolutely.
Yeah, I mean, I completely agree with you, and you and I have talked about it. I particularly, and I was going to comment on the chat, and then I refrained. But I think the term equity seeking in itself is problematic.
Yeah.
Right? Because nobody seeks equity. It ought to be something that we need to think about how we achieve for everybody, but nobody should have to seek out equity. So that term aside, I think coming back to what you were saying, and again, as we've chatted before, coming to Thompson Rivers, and that was one of my questions, is to say, I think it's phenomenal that we are reaching out and working with Indigenous communities, because we've recognized that a gap exists and we need to think about how to support that gap. But getting people in the door as students of the School of Nursing is really only the preliminary step. And one of the questions, and I would really invite, and it's a whole different conversation we can have, and I'd love to have it, is what do we need to do next? Because I heard from the panelists, and you know, it really resonated with me, is that, you know, if we don't, I mean, Danielle talked about it, I think Francine, you talked about it, I think Oliver, Lucy, all of you talked about the fact that, you know, when you come into an education system and it feels like it's foreign to who you are, right? And that your sense of belonging and identity is not there. And while I'm not Indigenous, I certainly understand that. I come at it in a different way. And I appreciate the importance of that cultural identity and being able to be who you are and being able to learn in ways that help you and being able to share the things that are important to you. And so for me, one of the questions was, it's great we're so fortunate to have faculty, Indigenous faculty, and we're so fortunate to have the commitment and having the Indigenous students, but then the so what? How are we paying attention to all of the other things that allows them to be proud of who they are, to further develop from the modeling and the support that we have of our Indigenous elders and our Indigenous faculty and our colleagues across the university? So that is a question dialogue I've started internally. And I hope that, you know, one of our webinars next time around might be very focused about and getting your wisdom on what else should we be doing. I think we need to do some of our work in terms of, because I know our faculty have ideas and things on that, because I've heard those, but coming together and then hearing from you about, to your point, how do we, it's not just about reaching out and admitting people, but ensuring that people are thriving, not just surviving, but thriving. And they will go on and be our champions and our leaders to do the transformation. People like Dion, it was wonderful, Dion. And I want to say hello from Donna Petrie. When she first sat the panelists and I sent her a copy, the link to the webinar, she goes, oh, this is so exciting. Dion was one of my students. So I just want to say hi from Donna. But that's what we need. We need our students like Dion to be the leaders, to do the transformation work that needs to be done across the system.
Thank you, Ronnie, because I really agree. It's time to shift, and I think all the presenters talked about that, is we have to change the system. So we have to stop, you know, start limiting our discussions on who the Indigenous people are, you know, their language, their history, all of that. That's so important. But we need to change the system so that when we come in, that they are more supported. So how we do that, I don't know. I've always dreamt, and you know, I'm going to put it out there, it's 2020, year of the nurse. I think we need our own Indigenous Health School of Nursing.
I'm just going to let that float. So while you were talking, a question came in. I'm just being mindful of the time, because once we hit our time end, Zoom will just end us all. So a question came in. Are other universities and colleges having core competencies? Can anyone speak to that question?
I think generally what we're seeing across Canada is people are starting to incorporate some core courses.
Okay.
And it's, Danielle, if I could just add one comment there, because I think it's such an important distinction, and I'm not sure if it came across as clearly, but then Francine, you brought it up as well, like the concept of being stigmatized or stereotyped. And so I think it's just so important that even as we talk about the courses or curriculum, we do often talk about Indigenous health, but what we're really talking about, this is my daughter, one of my daughters, what we're really talking about is the impact of Canadian colonial practices and policies on Indigenous people's health, so that we can refocus our gaze back on mainstream settler policies, practices, and ways of being that are problematic and that are blinded to Indigenous perspectives. Because I think if we continue to just focus on Indigenous health, we lose that other really critical transformation opportunity, which is exactly what you were speaking to, Ronnie. So, I mean, wow, I'm like picking my jaw off the floor to think that you guys are working with within such a supportive system. That's awesome. So I just wanted to add that. Thank you.
And I think there's a few more questions and comments that have come in, so I will capture those and I will send them to you, Lisa. But I think on an ending comment, this is a great one. For each panel member, what is one thing during your health education that would have or could have supported you? So
I will go first.
Yeah.
Because it's just so clear. I had an Indigenous mentor outside of nursing who was an academic who told me, keep going. You know, what I was writing, what I was saying, she was like, you got it, that's it, you know. But it didn't come from nursing, unfortunately.
I can go next. I feel the same. If I had an Indigenous mentor, that would have meant the world. However, I'm very grateful to BIU. I had Skapthut, which is a First Nation Student Services building. And when I felt the need to be where I needed to be grounded because of living away from home, being away from my community, all of my family, my culture. Her name was Marie. She worked at Skapthut, and I would just run up there and I'd go see her and she would ground me. And so I do feel that I strongly agree with that, having an Indigenous mentor. Thank you.
I can go. One of the things that really stands out most for me, and I was really hoping to get back to Kamloops for this, was Star Mahara's retirement party. She was my first year nursing instructor, and although not Indigenous, developed a rapport with me that really got me through my first year nursing. So for me, it's really having our allies that have a real, true understanding. We're talking back in 1991. And back in 1991, if we can have somebody like Star Mahara, we can have more allies and champions like her these days. So those need to be cultivated. You know, we need to develop those relationships and to bridge that gap and connection between our Indigenous students and faculty. So I raise my hands to Star.
And maybe is it okay if I go, Lucy, and then I can give you the final word? Would that be all right? I'll leave the final words to our illustrious Lucy. I was just going to say exactly that, like the two pieces would be just being able to be really grounded in my identity. So having access to my teachings and my elders, opportunities to go home and be on my territory. So having flexibility within the schedule and curriculums to support that, and understanding that that's a part of how I can be the best practitioner I can be. And then to Dion's point, in terms of those allies, like I think if somebody had really, the allies around me and the programs had stepped up and said, you are here to disrupt the status quo. That is your mission and your whole purpose of being here. So if you're not, I don't have a non-expletive way of describing that, but if you're not stirring up a lot of stuff, then you're not meeting your potential here, really, you know? So I think just having that permission and that space to not do things exactly as all of my settler colleagues were doing things, like that would have been a real, would have been super amazing. So that's all. Thank you. I'll pass it to Lucy.
Hi, everyone. Thank you very much. I think it would have been good to have mentors. Like I started out my talk is I didn't have anyone in my family that went past grade 10. And I was the chosen one somehow. And I didn't have any mentors. I was able to cling on to a few people who showed an interest in me, and I really took that opportunity to learn from them. And also the support that because I had to work and go to school at the same time, it would have been good to actually have funding that would support us to get through university as well, because it was really hard. But thank you very much, and I appreciate all those mentors who have been a part of my life and helping me to learn and grow throughout. Thanks.
Awesome. And so with that, I'd also like to just do a special recognition to all of the nurses on the line that were listening, all the ones that weren't able to make it. And I want to just, you know, really give you guys a big virtual hug for all of the support and the work that you've done over the years. It's not over. We've just started. So hi.